video series will help you understand your reading material, assessment, and health professionals education. Now I'll point out to you in this series what's important, what's not so important. So let's go right to it.
Just a short introduction to selected response items, the anatomy of a question. Okay, an item, or specifically a selected response item. Okay, so in each question there will be a statement. Okay, something. Okay, so say they give some more information about the fever, there's no fever, blah blah blah, and also complain of cough, da da da, and says there the most likely diagnosis is, you have A, is it B, is it C, is it and D, is it? Okay, now this is a typical single best answer, or some would call this is a typical multiple choice question, because you have choices here and the candidate needs to select which is the likely answer. Okay, now just some terminology, and this area is what we call as the stem. Okay, the stem. And this area is what we call the lead in. Right? A, B, C, and D are all options. Okay? And one of them, let's say B, is the key, the answer, the correct one, the most likely diagnosis. Whereas the others, okay, they are distractors. So the lead in, the options, the key, and the distractors. So in an SBA, the students need to read the stem, and the task is stated in the lead in, and he or she must choose from the list of options what is the most likely, what is the which is the option which most likely answers the question in the lead in. Okay, there are many formats of writing the lead in. There are many discussion about how many options should there be. Should there be 4 or 5 or 3? And there are a lot of guidelines on what's the best way to write the stem, what's the best way to, and so on and so forth, just as an introduction to you regarding the anatomy, the what you call these parts. Okay, and you, in multiple true false question, you might be familiar with the multiple true false question. Okay, again, you have a question up there, they are also called as the stem. Multiple true false questions do not have the lead in, and we still call the A, B, C, and D as options. Okay, and you do not have an answer key in the multiple true false. Instead, you must choose whether A is true or false, B is true or false, C is true or false, and D is true or false. Right? So the answer key is for all options. So for example, it's true here, but it's false here, and false here, and true here. Okay. So that is briefly the anatomy of a select response item.